I think this has been a great 6-month period for UCSF Medical Center and the Benioff Children's Hospital. Of course, you can't start any discussion these days without acknowledging the tremendous effort that the whole organization made to bring Apex live. We started with barcode medication administration, all of our ambulatory clinics, inpatient, outpatient. We are now at the forefront of hospitals in terms of electronic medical records. So I'm so proud of that really mammoth effort by a number of people. But that's not all. It's remarkable that in this last 6-month period, we've had the highest patient satisfaction scores we've ever had at UCSF. It's really tremendous. And at the same time, we've never done better on our quality and safety metrics. One of the things I'm really proud of is hand hygiene and how far we've come on basic hand hygiene in the hospital. But I could go on in almost every area, and I think every employee at UCSF has something to be very proud of, because we're making the quality of medical care here better, the safety of medical care here better, the patient experience better than ever, and we're starting to do it at lower cost. And that's really going to be the big driver for the next several years. The great thing about UCSF, in my 12 years here, I've just seen that every time we set a goal for ourselves, we gnash our teeth a little bit and we worry about whether we can achieve it. But then when we put our minds to it, we achieve it. Mission Bay, it wasn't that long ago, we had no thought that we could ever be in a position to buy land at Mission Bay, much less buy land and raise money and be in a financial position to build a new children's, women, and cancer hospital. But I hope everybody takes the time to go down to 16th and 3rd and see the spectacular new Mission Bay hospitals that are coming up before our eyes. The bar is being raised for us. On the national level, the expectations of quality and safety, patient experience are higher than ever. Clearly, the common theme in all the healthcare discussion is how can we lower cost, and we've got to be at the forefront of that. And so I think as we set our goals for the next year and for the coming years, the expectations of improvements in all those areas, quality, safety, patient experience, and doing it at far lower cost, that's going to be driving us. So the work's not going to get easier, it's going to be harder. The expectations are going to be higher, but if there's any place that can do it, it's the people at UCSF. The strategic plan for the UCSF campus begins with the very first goal that says we should provide unparalleled care to our patients. And that's really where UCSF Medical Center is focused, on that particular goal. We're engaged in all those goals, but mostly there. And that's what drives so many of the initiatives that we have here. It also drives us from the standpoint of our business operations here, because the medical center is one of the few areas within the university that can generate margins to support the academic mission and other initiatives of the university. I'm really proud of the fact that over the last decade that we've been able to invest over $1 billion in new capital equipment, new initiatives to support faculty and staff in a variety of efforts here at UCSF, because we were able to run the business of the medical center efficiently. I'm so optimistic about the future of UCSF because of all the assets that we have here. This is a very special place. We are so blessed with the quality of leadership here. It starts with the chancellor that I will just say is the envy of every other campus in the University of California and around the country. Sue Desmond-Hellmann knows academia, she knows business, and she is very focused on making this the really best health sciences university in the world, and we couldn't be more fortunate to have her. The deans of our schools, and particularly Sam Hawgood, we couldn't be more fortunate. So I feel like that group, coupled with the administrative leadership that we have, Jeff Bluestone, John Plotz, and others, this is a team that can really take us to a great future. But they're the leadership. It really comes down to the individuals here, and it's what each and every one of you choose to do. And I just would ask you to come to work every day with an open mind. How can we improve what we're doing? This is not an organization that says, if it ain't broke, don't fix it. We want to be an organization that says, whatever we're doing, how can we do it better tomorrow?